So Sami and I worked on this project with the Pulitzer Center, and it was the first of 3 projects that we ultimately did. The first one is this hospital crisis. The second one we did was about India's male-to-female trans gender minority, and about the sex work industry that surrounds them. And the final thing we did was about a heroin epidemic that was where heroin was flooded over the border after being liberated from the Afghan war, coming down through Pakistan and ultimately being dispersed from the coast of India. But we're here to talk to you about this first series that we did, which ended up being a 4-part series for the New York Times. The inception of it came from just an experience. I had my first son was born in a private hospital in Mumbai, and it was such an amazing experience. I mean, it was top flight medical care. The prices were low. My wife had a view of the Arabian Sea. We had all these different women attending to her after her C-section. And, I started to wonder, all the people that I would see on the street, just living on the street. I was like, where are all these kids coming from? I mean, who is actually, who is delivering these babies? How does it even work? It was just basic curiosity, which is I've told the journalism students today, where, that's where all good stories come from, is just wanting to know more information about something. So I had written a story about Dharavi slum without traveling particularly far from my home neighborhood in Mumbai, which is one of the largest slums in the world. And what I found was that healthcare was comparatively not bad. It was not as bad as I thought it would be. People were taken care of. There was all the mothers had individual nurses and doctors keeping tabs on them. This was all government workers doing that. But what I found out was that peripheral hospitals, which is a term in India that you hear, that come from rural parts of the country, that is where healthcare was really poor. And I didn't get to explore that much deeper. I did this story for the New York Times, and I got really fortunate because the Pulitzer Center, someone at the Pulitzer Center read it and said, listen, you got to apply for a grant and do more. And that's how Sami and I hooked up for the first time in this series. So what we decided to do with using that as a springboard is get deeper into the issue of government hospitals in India. India spends less per capita on healthcare than China by I think about a quarter of what China does. They're like 1/11 of what the UK does. They spend not enough, and the results they're getting from what they're spending are not there. And the biggest problem is outside of major cities and in rural areas where ultimately medical needs are neglected. The first place we went to was in picking the series was Kolkata in West Bengal, and basically where I was picking these stories came from just researching where had there been previous stories about government hospitals in India, and this came up because there had been a rash of infant deaths at this one particular hospital called BC Roy Hospital. And India's media is like, the worst of American tabloids, were like big, bold, screaming headlines, dead babies, terrible, terrible situation, da 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 da. And I decided, okay, so I'm going to actually let's go over there and try to figure out, why did so many babies die at this particular hospital? And what we found was that the situation was ultimately much more complex than the media had originally made it out to be. The babies had come from sometimes 2, 3, 4 hours away from Calcutta to go to what really was at BC Roy, the hospital with, hospital of death, whatever. that it was referred to as, which really was one of the better and better funded government hospitals in the entire state. But it got this bad reputation because mothers were coming to the hospital out of desperation with babies who were on death's door, and the babies that were dying there started the process of dying so far back in the chain. And this was ultimately, what was reported as, hospital of death was really this profound infrastructural failure on, on the part of the state government in West Bengal, and something that occurs throughout India. We had one medical student at Penn when we were speaking who said, "Oh, but in the developing world, healthcare is bad everywhere." I assure you that the things we saw are at the very bottom of bad. This is what we're talking about. Is there's a line of mothers waiting down the stairs with babies who are born prematurely because they are malnourished and are not receiving the proper amount of food. The mothers themselves are not receiving proper food while they're pregnant, and the babies are born sometimes a few months early because because of malnutrition. Then they have to wait online to use very poor equipment in order to try to save these babies. And as the line is, as they're waiting on this line with this overpopulation and just these, again, terrible conditions, desperation starts to set in. And that's when people say, okay, I'm going to try to go to Calcutta and save my daughter or son's life. But the process goes further back than these peripheral hospitals, and it goes to these things called primary health care centers, which is the actual beginning of rural health care for India. They're government centers that are almost completely neglected by state attention because they're so far removed from the cities. And at the place where we went, this is before the peripheral hospitals. They have this is a village with 150,000 people. So that's like what? That's much bigger than bookings, right? And they only had 2 doctors. They had one in the day and they had one at night. And so you can imagine a situation where a doctor has got 2, 3, 4 pregnant mothers at one time, which is totally possible with 150,000 people, and they only have 2 ambulances to take them to the peripheral hospitals. So this huge backed up line to actually treat these infants and to treat mothers who are in a bad way starts all the way back at the village where they're just completely neglected. So I'm very proud of the work that we did there, because I feel that even though it has not really spurred any kind of the kind of change that I want in terms of policy, I'd like to see a change in India. At least that information is out there, and we can get away from just scapegoating hospitals where a tremendous number of babies have died without actually figuring out why it happened, which was a case of very lazy journalism before. The next thing we did was we went to Gujarat, and I don't know how many people are familiar with India's current Prime Minister, Modi, but he was the chief minister first of Gujarat, which is a dry state. It's known as a dry state. It is a predominantly Hindu state. Dry meaning no alcohol. It's known for having at least the reputation that Modi brought with him is a stronger infrastructure than other states, theoretically, at least in the cities. And Modi was part of his appeal was that he was promising, or his supporters were promising this is what he's going to do to all of India. And he had part of his policies were these things called public-private partnerships, which we have in the United States and all over the world, which is when you pour private money into a public program in order to try to fix it and try to fix the kind of, government corruption and whatever. And he had done that with an insurance plan that was supposed to help the poor. in Gujarat. But what we ultimately, again, this was not, this did not receive the type of attention that policy triumphs in our 2016 election are going to be receiving from the American media. This was just sort of something that was bandied about and not really analyzed. And I think we were able to analyze it first. And what we found is, in the biggest hospital in all of Asia, only 150 people had signed up for this insurance in 1 year. There are a lot of people in India, and there are a lot of people at this hospital. How many? 30,000 beds? Like 30,000 beds, and like only 150 people for a government hospital that helps the poor had actually even signed up for this insurance that we had been promoting. And the people who did it, ultimately, the money that they had been, that they would have spent, that would have gone to the state, ultimately was being siphoned, redirected, mostly to private insurance companies. Very big companies. If you live in India, like ICIC Lombard, these things are like very, very prominent. So moving on to the last one, because I'd much rather you experience these stories through pictures, but it's good to get the background on it. I had read, I want to do something about HIV/AIDS. A lot of the people who funded us, it's very important to do, to deal with HIV/AIDS. The third most amount of AIDS patients in the world live in India, about any country. And I read a thing where it said that somebody had been completely rejected from a hospital for having HIV/AIDS, and there was a doctor who was attached to it who was complaining, and he was an activist who was saying this is not, and this article was like this big, and I was like, well, that's probably a pretty big story, because this is that time it was 2014 or 2013. This was like a kind of a 1987 kind of occurrence that was happening in our day and age, where somebody is tested positive for HIV/AIDS and then rejected from the hospital. So what we found is in Warangal, which is near Hyderabad, there's an entire tribe or caste of prostitutes that lives along an area where there are where truckers run through the state. And we found that this was not just one person, but many people were being turned away from government hospitals in this region for coming out with HIV/AIDS. Just complete misunderstanding. Someone have a cyst removed from their neck, and they would test positive for HIV/AIDS, and then they would be rejected for care and just left to fend for themselves. A Christian ministry, a Catholic ministry, had been taking people in and trying to assist them through that. So. Without further ado, I think we should start the photographs, and then probably continue to tell the story through that, because it's much more useful for you guys.
Thanks, Mike. As Michael explained, we started our journey from Calcutta. It's the capital of West Bengal, and we started off with the hospital that was in the news, which is called the B.C. Roy Hospital. It is the number one hospital for pediatric care in the state, and this is where all the children come from, infants come from the rural parts of the state. So we went to the hospital, we spoke to the doctors, and we visited some of the patients, their relatives, to get an idea of where the problem has begun. And here's the view of the pediatric ward, and what you see there is the intensive care unit for children, newborn babies.
Compared to the rural areas that we went, this was, we saw it in reverse order. It would have been almost more useful to go from the rural areas to here. It was far more advanced than we had anticipated there.
And this is a baby who's in the intensive care unit in an incubator, who's getting some ultraviolet.
Yeah, this is in Burdwan. This is in in one of the peripheral hospitals that I mentioned. So this is where this baby actually made it through, but they as you can see, the baby is suffering from a lot of diseases that are related to malnutrition, and is in an extremely weakened state and continue here.
And this is in front of the BC Roy Hospital, where because of the overcrowding and patients waiting to receive their care, they camp outside the hospital. And especially when there is a rain, after the rain, when there is an outbreak of communicable diseases, there is a huge number of people who typically wait outside the hospital to receive health care. And this is a CT scan unit just inside the campus of BC Roy Hospital. It's also to show the lack of essential infrastructure within the hospital campus. And this is in Burdwan.
Burdwan
Yeah.
also. This is also one of the peripheral hospitals. You can see people, patients coming up the stairs here.
And this is the Burdwan Medical College Hospital, where it is a teaching hospital. So there is a medical school, and it's at the pediatric ward. One of the, you will see pictures like this often to emphasize the overcrowding of the hospitals, and overcrowding is due to, lack of healthcare. And in this picture, you can see the mothers providing assistance to the nurses.
Yeah. So when you see this particular room, it's difficult to get to understand that. I mean, Sami's eye is focused primarily on this, the kind of the urgency of the mother treating her own child using the equipment at the hospital rather than a doctor. But what is lost in the picture, I think, is the depth of the room. There are like 150 beds in one room, with all mothers tending to their children. In this one particular room, there are blood stains on the walls and feces stains on the walls and things like that. I mean, stuff that is like really not only upsetting to see, but also like extremely unsanitary. So this is more in that. Okay, so you see the Chips Ahoy thing. So essentially, to give you an idea of how poor this hospital is, there is a factory that makes the foil wrappings around Chips Ahoy, Airheads, Nutter Butter, these type of products. Those kind of like foil wrapping. So they make it in sheets, and you'll notice if you see those products that they use the same material but with a different print. So the company that makes that the extra sheets are either stolen from that factory. We weren't entirely sure how they got them, but that was what was being used as the bedding for a lot of people at the hospital.
And you can buy them for about $1 outside the hospital.
Yeah, for about $1 outside for people who are waiting outside the hospital to be seen. They want to do some extra bedding.
And this is going back to emphasize the poor sanitary conditions. And there's not enough room to place the bed, so they have to use every single space that's available. And one of the things we often seen is the poor maintenance of the medical equipment. So we've seen so many decommissioned lab equipments and stands and so forth.
That's one question that we received so far on the tour that we've been on a lot has been, why are the doctors talking to you if the conditions are so bad? Well, the answer is that the doctors want to talk to you because they want better equipment. They want people to know about the conditions in which they're working. The problem is the doctors are often scapegoated. Say like, oh, we got terrible care at this government hospital, but the doctors are sometimes up for 24 hours straight, 48 hours straight working because there are not enough doctors to meet every person. They're using equipment that is dated. They are forced to be like tech people in the middle of the day trying to fix equipment because of the degree to which they're understaffed.
And here's the mother waiting outside the intensive care unit as her child being treated. And I've got a few images to show you how, where they live and how, what type of demographics we're talking about. So most people come from a rural background, slum areas, and this is a typical scene of a family living in a slum and near the Howrah Bridge in Calcutta. and you have thousands of huts built by the railway tracks, and so access to healthcare for them is challenging, and they rely on the public healthcare.
So I mean, for you guys, I mean, you see this and you're just like, okay, there's a lot of garbage on a railway track, but it's important to understand that that's ubiquitous, unless you are, of course, in an elite and you have access to air conditioning and which keeps the mosquitoes out and things like that. The majority of people are living in conditions or close to conditions that where trash is universal, and that spreads a tremendous amount of disease. And
here is a pharmacy at a primary health center in a place called Borsol, outside of Calcutta. And usually primary health centers are supposed to be equipped enough to treat the basic...
I want to add one thing here, if you're done.
Yeah. Go ahead.
No, I just want to say that this is just a slight political thing I just want to throw in. The Trans-Pacific Partnership that was just recently signed, that was negotiated in secret for a long time. You'll often see like Doctors Without Borders making a big deal, saying, okay, this thing is a problem. Like Obama, Cameron, all the world leaders kind of signed off on this thing. One thing that it affects is patent protection for generics, and the poor use these drugs where the prices are driven way, way, way down. And with the change in patent protections, there's going to be a lot of threat to the NGOs and things that help these people. So I would be remiss to not mention that the price of generics, is threatened to go up before the patents for drugs where the patents haven't expired yet, and it could create a serious loss of life in the developing world.
And here is the doctor who is prescribing medicine, and as Michael pointed out earlier on, this hospital is supposed to have 2 doctors, and there's, sometimes they don't show up.
No, there's no doctors.
And, in this case, when we showed up, the doctor was not there, and somebody has to go and get him to come and talk to us.
These are the primary health care centers I mentioned. This is the first line of defense that they have before they go to the peripheral hospitals, and then they go to the cities.
And this is an operation theater at the same primary health center, which has been decommissioned for a very long time. Even the doctor did not know when it was functional.
Yeah, it's just, if I really love this image that he took, because the kind of like the ghostly light through it, but in a more practical sense, there's a layer of dust over everything. Where if you can, the light gives this really evocative image that looks haunting. But in a practical sense, you could draw your name in all the dust that is in the operating table.
And it's a maternity ward where the woman is waiting to give birth. And, it was cold, the walls were broken, and, broken cots.
There's no heating, obviously, in the wintertime, and buildings are designed in India often with an idea that they won't be air conditioned, so the idea is to protect from the heat. So you have these like high ceilings and stuff like that. The problem is during the cold season, it traps in the cold, and so it can make a very sad-looking maternity area look much worse.
And this is VS Hospital in Gujarat, in front of the VS Hospital in Gujarat, where the current Prime Minister Modi was the Chief Minister. And the state has been in the news as a developed state under Modi's government. And you can see the puddle of water and sanitation.
One thing that we were pretty shocked by in Gujarat, you can just keep changing pictures, is that people were recycling tubing for blood transfusions.
Yeah, and again, hundreds of beds in the ward filled with.
So this is not like that's Modi is not. It's not his fault that they're recycling. It's not like the thanks Obama. Or whatever that joke. Okay, but it's like it's not like, oh, thanks Modi, you're recycling tubing. However, it's important to note that his the idea of infrastructure was very important to this guy's campaign. That like Gujarat ran better than everywhere else. So we were actually really shocked by the quality of the government care that was there, and the degree to which his health care plans had not really made much of a difference between that and other areas like in Calcutta.
And it's people waiting to get into the urology to see a urology doctor, and again overcrowding, and a view of an emergency ward, to VS hospital.
How many people? That's the thing that just was so overwhelming. Coming back,
Yeah.
and recontextualizing. It's just so many people. Here's a guy with his his positions, and is that a urine bag?
It's a urine bag
Yes,
for
it's his
Dallas.
urine bag, and he's out in the hallway, with nowhere to sit.
And this is the view of the VIP room at the same hospital. So you can see the parity between
So if you want to know
people who can afford and not.
how the elites deal at the government hospital, now most of them go to private hospitals, but the politicians tend to say, okay, all right, so on and so forth. I'm just like you. I'm of the people, and like I want your votes. So even I go to this VS hospital, but when they go, that's where they hang out, in a place where no one else is allowed.
And often relatives help the patients to move from one ward to the other. So these stretchers are carried by the relatives and help them with their IVs and between, transferring from the operation theater to the wards or from the emergency to the general ward. And this is the blood bags, blood lab at the VS hospital. And one of the things is the reason they recycle is to save money, so they can account for new blood bags, but they pocket the cash. And this is a laboratory at a primary health center in Bihar, which is something I've done on my own for another project. This is the Gandhi Hospital in Hyderabad. This is the hospital where people with HIV were denied treatment. So the doctors there, they were scared of getting infected by the HIV virus, so they deny any treatment to the people with HIV. And here is a patient who's a motorcycle mechanic, and he had a cyst, and he went to the doctor, and they discovered he had HIV.
Yeah, I just wanted to add that the reason why this particular picture you don't see his face is because this guy is afraid of, was concerned about additional stigmatization from being an AIDS patient to begin with. So he was willing to talk to us, tell us about his experience, but didn't want to. So he basically had a cyst in his neck, and it was removed. And he was denied care, and then he received care through the help of a really generous doctor who works with he's religiously Hindu, but works with a priest at a Catholic mission, and they kind of collaborate together in order to try to take care of some of these patients. One thing you find is really tragic stories like the wife doesn't have HIV/AIDS, and the husband does, and then she's taking care of him, or things like that.
Like in this case where the husband contracted HIV, and then he gave it to the wife, and they've been looked after at this missionary hospital near Warangal, and they get free treatment. And this is the general ward. People receive the treatment.
So yeah, this is at the Catholic mission.
And the missionary also has an orphanage for those children who were who got the virus through parent-to-child transmission, and the relatives, they don't want to look after them, so they end up in this orphanage.
Yeah. So basically, the level of stigmatization is really high. This guy came from where? Bombay.
From Bombay, because. Yeah. His uncles didn't want to look after him.
I think he had some mental disabilities as well, but he was born with HIV/AIDS, and they just they're just cast out, and this is we worked with transgender sex workers, and they are aware of the risks they take when they take risks. but sometimes working class people in Warangal, transgender sex workers know because there are outreach workers who are targeting them because they're such a the population is really susceptible or vulnerable, I should say, to exploitation. But in this case, you have people who, where they just have not received the proper education to know that the disease is not going to be passed from just him sneezing.
And this is the female or girls section of the orphanage. They're actually rehearsing the Titanic song for an upcoming event.
Dance remix of
Dance, yeah.
My Heart Will Go On.
And in the orphanage, you see often how these kids, they support each other, and they are their family in a way to provide comfort and support. I guess that's all I've got. And if anyone of you are interested in applying for grants through Pulitzer Center, we would definitely encourage that. And they have a lot of programs for students through their Students Fellow program as well as the Campus Consortium program. So feel free to get in touch with any one of us or through Dr. Olson, or check out their website.
Okay. I think we hit that. Did we hit that?
Yeah. Well, thank you.
Thank you very much for having us.